Forget everything you think you know about the history of medicine, before the pyramids, before farming, before we even learned to write our own names. Someone somewhere picked up a sharpened stone and performed surgery, not a wound that healed on its own, a deliberate operation, a cut made on purpose to save a life, and the patient survived. In the next few minutes, we're going to travel back further than the invention of the wheel to uncover 8 forgotten operations, real people, real bones, real evidence, that prove humans were practicing surgery tens of thousands of years before recorded history began. You'll meet a Neanderthal with a filled tooth, a hunter-gatherer in Borneo who lost a leg and lived 9 more years, and a cow in Neolithic France that may have been the world's very first surgical guinea pig. By the end, you'll never look at a modern hospital the same way again. I'm your host, and this is the Knowledge Vault. First, let's be precise, because surgery gets thrown around loosely. Surgery means a deliberate, intentional operation on living tissue, cutting, drilling, or removing something to treat injury or disease. It's different from a wound that simply scars over on its own. Archaeologists look for one key clue: healing. If bone shows new growth around a cut or a hole, that means the person was alive afterward, and someone kept them alive long enough for the body to repair itself. That single detail, a smooth, rounded edge on ancient bone, is the fingerprint of the world's first doctors. Our story begins not with humans, but with Neanderthals. In Siberia's Chagirskaya cave, researchers found a Neanderthal molar with a deep, precisely bored cavity. Under a microscope, the edges are smooth and worn, meaning this tooth was used for years after the hole was made. Someone drilled into a living Neanderthal's tooth, almost certainly to relieve pain from infection or decay. That makes it the oldest known dental procedure on Earth, performed by a species we once assumed were incapable of this kind of precision. Now fast forward to 31,000 years ago in a limestone cave called Liang Tabo on the island of Borneo. Here lies a young adult missing the lower part of one leg, but this wasn't an accident. The bone was cut cleanly with a stone tool, and the remaining edge is smooth, remodeled, healed. This person didn't just survive the operation. They lived another 6 to 9 years afterward in a hunter-gatherer society with no antibiotics, no anesthesia, just enough medical knowledge to stop the bleeding, prevent infection, and manage recovery. Before this discovery, the oldest known complex surgery was a forearm amputation from Neolithic France, dated to around 5000 BCE, roughly 7,000 years ago. That skeleton also shows a fully healed cut, meaning that patient walked away too. The Borneo find pushed the timeline of serious surgical skill back by tens of thousands of years, long before agriculture, writing, or permanent settlements even existed. Then there's trepanation, deliberately cutting or scraping a hole into the skull. It sounds terrifying. It might be the single most common piece of evidence for ancient surgery on the planet. In France, around 6500 BCE, one skull was found with a round, beveled hole and new bone growth around the edges, proof the patient lived. That single discovery led archaeologists to uncover over 120 prehistoric skulls in the same region. 40 of them had been operated on the exact same way, and this wasn't a one-culture phenomenon. On the other side of the world, in Neolithic China, archaeologists found a skull from the Dawenku culture, dated to roughly 3500 BCE, with a perfectly round hole, rimmed with thick, healed bone. 2 civilizations, no contact with each other, the same idea, the same result, survival. But here's where it gets strange. In Champdouran, France, around 3400 BCE, archaeologists uncovered a cow's skull, with a large hole cut using the exact same technique as human trepanation. Unlike the human cases, there's no healing here. The cow didn't survive, which raises an unsettling and fascinating possibility. Was this a Neolithic surgeon practicing their technique before operating on a person, learning where to cut, how deep to go, before ever touching human skin? If so, it means ancient surgical training might be almost as old as surgery itself. By 3000 BCE in Egypt, surgery had evolved into something we'd almost recognize. In tombs near Luxor, skeletons were found with broken femurs and forearms, still held by wooden splints made of bark and linen. The bones had fully healed in place. This is the oldest direct evidence of deliberate fracture care, and in the Indus Valley, around 2200 BCE, at the site of Lothal, archaeologists found a child's skull with a small, carefully drilled hole in the front and clear signs of healing. Even a child in an early urban civilization was given surgery for a head injury or illness and survived. So why were people doing this? The honest answer, probably both medicine and belief. Some trepanations may have been meant to relieve pressure after an injury. Others may have been spiritual, an attempt to release pain or something believed to be trapped inside the head. By 1600 BCE, Egypt's Edwin Smith papyrus was describing head trauma treatment in writing. Centuries later, Hippocrates formalized trepanation with bow drills. In India, the physician Sushruta was performing reconstructive surgery around 600 BCE. And in the 10th century, the physician Albucasis designed surgical tools that, genuinely, look almost identical to instruments used today. Every scalpel in every modern operating room traces its lineage back to a stone blade, held by someone with no textbook, no training program, just observation, courage, and trial and error. Here's what should genuinely unsettle you. Every single one of these people, the Neanderthal with the drilled tooth, the hunter in Borneo, the child in the Indus Valley, went through their operation without anesthesia, without sterilization, without any guarantee they'd survive the night. And yet, again and again, the bones tell us the same thing. They lived. Surgery isn't a modern invention we perfected. It's one of humanity's oldest survival instincts, the refusal to let injury, infection, or disease be the final word. So the next time you walk past a hospital, remember, that building is the end of a 59,000-year-old story. And somewhere, right now, someone is still writing the next chapter. If this kind of hidden history fascinates you as much as it fascinates us, hit subscribe. Because at the Knowledge Vault, we dig up the stories textbooks left buried.